A hereditary cancer syndrome is identifying either clinically or through genetic testing is a person that has a genetic error or a genetic problem that's putting them at higher risk to develop cancer in the first place, and may also indicate a higher chance that they will develop additional cancers in the future. The other part of a hereditary cancer syndrome is that the risk to children of inheriting that same genetic problem is increased, and the risk to siblings is also much higher. My name is Namey, and I'm one of the senior genetic counselors at the Gregory and Lorraine Harper Cancer Risk and Genetic Assessment Program at Lehigh Valley Health Network. Some of the risk factors that we look for in identifying someone that might benefit from cancer genetic counseling are individuals who have been diagnosed with cancer at a younger age of onset than when that cancer typically occurs in the general population. The other thing might be a strong family history of cancer, where we see multiple family members on the same side of the family over multiple generations developing cancer. A person that's been diagnosed with more than one cancer over the course of their lifetime, so new cancers that have happened separately, or a rare cancer, such as a male breast cancer. We can see a person who has a diagnosis of cancer and their doctor may be concerned that they're at higher risk for other cancers to happen in the future. And if we identify that they in fact have a hereditary cancer syndrome or predisposition, we can offer them a proactive approach and hopefully risk reduction for any future cancers. A patient can either self-refer if they have their own concerns, or a physician can refer a patient to our cancer program. It may be helpful for you to bring along a list of questions that you've thought about in advance so that we can be sure to answer all of those questions during the time of your visit. You are also welcome to bring along family members who may also benefit from hearing the information and provide an additional ear for you, because it can be a lot of information that we talk about during the visit. On the day of the visit, you would meet with a genetic counselor who will spend time reviewing your personal and family history of cancer and provide some education about hereditary cancer. We would do an assessment to determine if you meet criteria for genetic testing, and at that time, if it's determined that the criteria has been met, we would talk about the benefits and limitations of genetic testing. We can typically offer you testing the same day as your initial appointment if you decide that you want to proceed with testing, so that you don't need to schedule a return visit. If the genetic testing is positive and a person is identified as having a hereditary cancer syndrome, we do bring them back to meet with both the genetic counselor and the medical director to review these screening recommendations, risk reduction options, and talk more about the implications of that result. We know that the decision to come to see a cancer genetic counselor can raise quite a bit of anxiety, especially when we start talking about personal and family history of cancer and the risk to develop cancer. But we're here for you. We know that these topics can be very sensitive, but genetic counselors have quite a bit of experience in walking patients through this process, talking very carefully about the benefits of genetic testing and the things that you can do differently to try to address that cancer risk.